I wonder if you could introduce yourself and tell us a little bit about your experience with ovarian cancer.
Yes, thank you very much. I think I'm so grateful for being here and can give my experience to you. So really shortly, I can say that when I was in 2008, 27 years old, I was a good, healthy young lady and got to a regular checkup. And then they saw something on my ovary and they thought it was a benign cyst. And we did surgery in my central hospital. But the pathology answer, they told me that it was a really rare ovarian cancer. And then they said, okay, we have to put you to the university hospital to do a new surgery to look around in the stomach if there's some metastasis. So shortly after my first surgery, and I got to the university hospital with a big surgery. And it was not spread at all. It was just good. It was the one tumor. It was big, but they took it all away in the first surgery. And then I got to have no chemo or nothing because it was in stage 1A, I think. But half a year after that, I got really pain in my back and I was training hard and competing in half marathon. So I thought it was because I was overtrained. But then I got to a checkup and I had so much pain and they saw in my kidney, it was a big tumor. So it was really sad. It came back really soon. But then I had to wait almost 2 months for a surgery.
Right.
And it was also in the university hospital and they took away my kidney and the tumor. Those surgeries was 3 big ones in 1 year. So wow. It was really, really hard to recover. And after that, I got 2010, after the third surgery, chemo. And I was a really bad patient because I was feeling nausea all the time. And I was just lying down for 2, 3, 4 months at home and need help from my mother and father with everything. And after that, quite soon I was trying to go back to normal life, but it took half a year. And I was really tired and fatigued, and also the hyperthyreosis was coming, and I got answered that the left ovary, they just took one ovary, and the left ovary was not function anymore. So I got to the menopause also at the same time. So it was quite hard for a while.
It sounds like it. And when you had your first diagnosis, did that happen fairly quickly after you went to the hospital or to the doctor? Did you have any delay in diagnosis?
No, I think it was quite soon because they saw it was a benign tumor and they did the surgery and the pathological answer came 4 or 5 weeks after that. And then I waited 3 weeks and then the second surgery. So quite soon, every surgery. But the third surgery then was delay of 2 months.
Yeah. And how, I don't know a lot about the Finland healthcare structure. Is it like, did you have to pay for any elements of your care, or is there a health system that covers care?
Yeah, we have a good health system. It's the public health when you have to go to the public health from the beginning. I was a student at that time, so it was the student healthcare that took me and give me forward. And then I just paid for those days I was in hospital. It was, I think, 50 euros per day.
Okay.
So it was not bad, but if you are really low income patient, it can be bad because I was a week there. And also the chemo, when you get it so often, I just paid 12 euros per day for the care. Yeah.
And what would you say, and I know you went on to start your own advocacy group, but what would you say would be the sort of most significant challenges in Finland for women with ovarian cancer or women who are waiting to be diagnosed?
I think it's almost the same problems as in every country, that the women doesn't know the symptoms and they go too late to the doctors. I think it's the same problem here, but that's just so important that someone is telling and do the awareness that here's the symptoms, please go to regular checkups, and please don't be afraid to go to a gynecologist. So I think my advocacy, or the group I have built, the association, it's the first in Finland and only in Finland for gynecological cancer patients. So we have a really hard work to do to come forward to the women to say everything. But I also know in Finland that women are high educated and they know quite much about symptoms and so on. But even though,
Yes.
the same problem.
So you and your organization are a member of the World Ovarian Cancer Coalition, and just what would you say what is the positive aspect of being a member, if there is a positive aspect?
Of course, it's positive. I'm so glad that we can be with you and have contact, because we are a new association, just 2 years old, and we didn't know when we built this organization that it will become the COVID pandemic. So I think we have had challenges, but also done very much work in the social media to get awareness to everyone. But I think it's good to be with you and have the cooperation, because we get ideas from you, we can get information, and to get also now to the Ovarian Cancer Day, all the materials in our own language. So it's easier for us also to do the work when we have it almost already.
Excellent. Thank you so much, Eva Maria. That was really, really interesting.
Thank you so much.